Good morning, everyone. Beautiful, idyllic New England morning here. Still summer, but with a little touch of fall, which I love that transition, love that weather. I want to thank our sign language individuals who are here. Thumbs up on that, appreciate that. Before we start, let me take my mask off. I'd like to have a moment of silence for our beloved former Mayor Billy Sullivan, who passed away late last week at 95 years old. He was a true champion of all things Springfield. So Mayor Sullivan, rest in peace. If we could just have a moment of silence. Thank you very much. We have new cases. The trend, a good trend, continues, and I know Dr. Kerouac from Bay State and Dr. Roos from Mercy are very happy with that. And again, I'm very thankful that both these individuals and the respected institutions are here, and they will come up after my update, and they will give their update. And as we've done before, subsequently, the media will be able to ask questions right after their updates so they can get back to their important work at Bay State and Mercy, and then we'll go into our city cabinet's heads update. So for new COVID-19 cases, we stayed in the single digits again. Friday, 6, Saturday, 4, Sunday 2 for a confirmed. Now these are confirmed, not probable, and Commissioner Carlton Harris will speak of that, but these are confirmed cases of 3,004 total confirmed cases we've had since this start of COVID-19 coronavirus. Deaths, knock on wood, thank God, no new deaths, and again, to those who have lost family members and friends, our thoughts and prayers and sympathy and encouragement go out to you and yours. 131, so it has stayed status quo. Of that, 57 are white, which is about 43.5%. 31 are black, which is 23.7%. 41 are Hispanic, which is 31.3%. And Asian is 2, which is 1.5%. In turn, the residential deaths have stayed status quo at 74, long-term care 57. Senior meals continue to be delivered. Helen and your team and Sandy and Vanpool, we appreciate that. Commissioner Carlton Harris will also give you an update. She had visited a couple of our local colleges that started on campus, Springfield College and Western New England University, and she will give you an update on travel restrictions. Some have been lifted to other states across America. Just to let you know, next Monday is Labor Day, so we will not be getting together. We will get together Tuesday of next week to do our usual press update to the media, residents, business community of Springfield and Western Massachusetts. I appreciate the partnership with AMR. Patrick Pickering, who is the regional director, is here today, and they're doing some testing for us too, and Helen will speak of that. The good news is that last Thursday, personally, Governor Baker, who was in town for a major economic development announcement that we had, announced that Springfield, and he said it was tremendous, especially being an urban center, not only in Massachusetts, but in the country, has gone green. So that is a tremendous accomplishment and a testament to all my cabinet heads and rank and file, and to you, the residents and the business community of the city of Springfield. We're getting there. This is not over, knock on wood. So we have to stay ever vigilant and continue to follow all the public health and safety guidelines. But by DPH's metrics, the map of City of Springfield is now green, and that is truly a tremendous accomplishment and resiliency of everybody involved. So to everybody involved, I want to give you all our round of applause. And a testament to our great medical institutions here with Bay State and Mercy, because we worked hand in hand on this. We also, again, announced another project that people said that would never get done here in the city of Springfield. After 30, nearly 40 years, but 30 years, 31 Elm Court Square project is going to be completed with market rate housing and retail and restaurants. So that's outstanding to all the partners there. Our early voting went very, very well, brisk here at City Hall and Greenleaf Community Center. I want to thank the Claudio Concepcion Center. I want to thank our Election Commissioner Gladys Oyola and her team and our facilities management. They did a fantastic job. I urge each and every one of you, if you have not voted, please, tomorrow you can go to the polls and vote, and they will be safe and sound. So please, it's important that you go out and vote. Again, I can't say enough. Census, census, census. Please fill out your census. I believe we have moved up to about 58%, and I think the state average could be 62, 64, so we moved up from the 50 percentile mark. If you don't get counted, not only don't you count, but the city of Springfield doesn't count. So please fill out your census. It's very, very basic information. As I indicated before, AMR is doing tests in Eastfield Mall. Tapestry continues testing. Commissioner Carlton Harris will speak of that. We had a great event, Springfield Unity in the community, and I want to thank J.B. Bland and Captain Joe Harris of the Sheriff's Department and Sheriff Cochee and Commissioner Clapprood. They were there, and a diversity chief inclusion officer, Talia G., myself, our police officers who volunteered, and the Sheriff's Department who volunteered, City Councilor Tracy Whitfield. This is our proactive initiatives to engage our young people of all creed, colors, and background to come together. And this was a skills competition, hoop basketball skills competition that went very well at my new South End Community Center. And it was great to see those young kids and their families there developing and enhancing relationships in a positive environment. So we're going to continue with that. We did have, I know I mentioned with Commissioner Helen Carlton Harris, but we did have a good introduction meeting with the new president of Western New England University, the very dapper and able president, Dr. Robert Johnson, and we spoke of COVID-19, what they're following through with Helen, off-college campus housing with Deputy Steve Kent and Building Commissioner Steve Desolette, about respecting our neighborhoods. Dr. Johnson's very keen on community involvement and economic development. We're going to have subsequent meetings. And also education, obviously, dual enrollment. Assistant Superintendent Lydia Martinez represented the school department at that meeting, and we were very thankful to Dr. Johnson. Addie, his nickname, the Somalian refugee from Duggan Academy, Superintendent Warwick, we all worked together, and he's going to go to Western New England University, and we had some anonymous donors too, to become a doctor, and he survived himself a major heart surgery, and he wants to become a heart doctor. So it's a great story for our public school system. It's a great story for Addie and his family, and it's a great story for Western New England University. So we're very happy about that. Commissioner Clapprood indicates to me that nobody is down on COVID. That's fantastic. Drag racing, again, we're going to continue to attack them. 5 more arrests were made in a North End unit that we had down there in drag racing. I don't know when the hell they're going to learn, but we're going to keep grabbing them and confiscating their vehicles and arresting them until we eradicate it from the city of Springfield. Commissioner Calvi indicates to me down 1 with COVID-19, and they had a good, not a bad weekend. They had to deal with A couple minor situations, but things are going well there. Superintendent Warwick informs me that this past weekend, 77,110 meals were given out. Again, those are breakfast, lunch, dinner, and snacks. We are well over 2.5 million meals given out to our families and students in need here in Springfield. And we continue to move forward on reopening. Professional development was all last week. Superintendent will update you that now all the teachers and staff, administration, counselors, and ancillary staff will now be in a 2-week full court press on heavy reach out to the parents on what to expect and to hear their questions and needs. Laptops, another laptop round will go out. The iPads we're getting for pre-K, and supplies too that are needed. We're going to be handing out and doing supplies from there. DPW Director Chris Signoli, nobody's out on COVID. That's fantastic. And bulk pickup, there was a little bit of a delay, not our issue, but the contractor's issue. But we're working on that, so we've contacted people on setting up some new dates pertaining to the electronics. Pat Sullivan on facilities and parks. The rink, or Arena, will be opening up September 18th. They are halfway through the analysis of all our school buildings with Superintendent Warwick and our industrial hygienist. And we just received a grant from DER, Department of Environmental, on pertaining to boilers, which we're very, very happy with that. Echo Dev, Director Tim Sheen will update you on the 4 rounds of Prime the Pump. 72% of those monies, which are grants, have gone to minority, women, and veteran-owned businesses. Again, 72%. Nonprofits, awards that have gone out, 30% of their board of directors, again, minority and neighborhood representation on that. We will be making some further announcements as we continue to work with our police department on homelessness situations and mental health. The mental health, really getting the mental health institutions involved in helping out the initial response of our police departments. Common Capital, the monies that we've put out, and again, we've put out well over $5 million, we're going to use that leverage. They're reaching out. Director Sheen will tell you they're reaching out to small businesses now on loan programs. So besides that, we've also put $2 million out through Wayfinders to help out our residents, paying their mortgages, rents, and utilities. So we're very proud we've been able to continue to accomplish that. On the finance side, our CAFO, TJ Plan, informs me since this COVID-19 coronavirus started, we are down. Revenue is down $5.8 million. For FY21, we are down $887,000. Our overall number that we've spent is starting to go down about $5 million because we're offsetting on grants now that we're starting to receive, and that's important. So I appreciate TJ and the Finance Division on that. On our legal update, and Helen will give the travel restrictions. Attorney Mahoney had mentioned that. And with Solicitor Pakula, we continue to work with MGM, and I've spoken to Bill Hornbuckle prior and Chris Kelly a few times with the goal, once the Gaming Commission on public health aspects is able to relax those restrictions, their goal is to get those workers back ASAP. Over the weekend, continued my dialogue with Judge Ireland as we continue to work on putting across with DOJ and with our police department and Solicitor Pakula. So with that, I'm going to turn it over to President and CEO of Bay State Health Systems, Mark Kerouac. And again, I'm very deeply appreciative of all his efforts and his team's efforts to be here each and every Monday. Dr. Mark Carwell.
Good morning, everybody, and thank you, Mr. Mayor, for holding these events, and give you the big thumbs up this week for Springfield being in the green. Congratulations to your whole team and to all the citizens of Springfield who've been working so hard to contain this terrible infection. We're continuing to care for COVID patients at Bay State Medical Center, roughly at about the same level as last week. This morning, 17 patients hospitalized, 1 in critical care. So really not much of a change over the last several weeks. I brought my usual high-tech graphic here to show you our epidemic curve. See the big peak in the blue in early April, a little bit of a knuckle here in early August, but things are really back on the decline after that. We're continuing our efforts at testing roughly 1,000 people a day, scrounging for supplies, as I've reported before, and supporting as best we can congregate living facilities and other healthcare providers. Our overall positivity rate for tests is 1.1%, which is only slightly higher than the state rate of 0.9%. As the mayor mentioned, the state is now publishing a weekly report looking at the towns and cities, and what they look at is an average over the last 14 days of the new cases per day per 100,000 population. And they give them red, yellow, or green, or even white if they have very few cases, codes. Springfield has very happily moved from the yellow to the green, which is no small accomplishment for a big city. I think it's important to realize that even within a big city, there may still be hot spots in given neighborhoods or zip codes, but overall, the city is definitely heading in the right direction. And because Springfield's an economic center for the whole region, we also need to pay attention to what's going on in the other towns and cities, and they are also heading in the right direction. Holyoke, Agawam, South Hadley, and Palmer are all in the yellow, and all the other cities, including Westfield, West Springfield, Chicopee, are in the green. There are no cities or towns in the red zone in all of Western Massachusetts, which is a very good thing, and it means there's been sustained improvements across the region. The Public Health Institute of Western Massachusetts, which is a not-for-profit organization that Bay State funds, has begun to publish a county-by-county map. And if you look at Hampden County, if they were a city or if they were a town, they'd be at 2.8 per 100,000, also in the green area. And across the whole county, there's a 1.27% rate of positive tests. So all the indicators for Western Mass are heading in the right direction. All the indicators for the state as a whole in terms of test positivity rates, hospitalizations, testing capacity, and the effectiveness of contact tracing are also heading in the right direction. But there are at least a half a dozen cities in the red, some at very high levels of new case finding, meaning that transmission is still occurring in little places here and there. This virus is constantly trying to make more little viruses like itself and is constantly trying to spread, and so we need to be on our guard. We're really kind of at a low simmer across all of the towns and cities in Western Mass, but that's because everybody is continuing to put forward the efforts to keep the virus under containment. Outside of Western Mass, a somewhat different story, as you know. The United States passed 6 million new cases just over the weekend, 182,000 deaths. Globally, 25 million cases with 844,000 deaths. A lot of hotspots in different parts of the world, including South America, the Middle East, India, and Africa. And we know that those death rates are really an underestimate depending on how much testing is going on. Here in the United States, it's estimated that there might be 30% more deaths than those that are confirmed by testing. Massachusetts has showed 118,000 cases with 8,800 deaths, and as I mentioned before, a handful of red zones. The greatest threat right now, in my opinion, in our country is the reopening of colleges and universities, where students from all across the country or across the world are coming and not always following the rules that their schools are setting. The New York Times has been tracking 1,500 colleges and universities and has found 26,000 cases amongst those students, with 64 deaths. And it's caused a lot of colleges to slow down their reopening plans. Just over the weekend, there was an outbreak of 21 cases at Holy Cross related to an off-campus party. And college students will be college students, and the enforcement of even well thought out reopening plans is a challenge. There is, of course, a lot of concerns about reopening schools. I believe that there has been good and flexible guidelines put out by the Department of Elementary and Secondary Education, and that Springfield has put forward a reasonable plan. With that said, the virus can transmit in closed spaces where ventilation is poor and people are either talking loudly or singing. Remember the outbreaks related to bars that people have had in different parts of the country. So many of the schools, and I know Springfield is among them, are looking at their ventilation, keeping class sizes lower. The bottom line is there is no perfectly safe option. I think that we can learn something by looking at different countries that have tried to reopen. Germany is one I've been keeping an eye on, where they've been very successful in reopening their educational system with a combination of fast and free testing, effective contact tracing, and beginning at a low rate of community spread, kind of like where we're at in Western Mass. So I do believe we have a fighting chance of being successful with a hybrid model of reopening elementary and secondary schools. Along those lines, I wanted to let everyone know that Bay State Health is putting on a virtual event called Ready for School COVID-19 and Your Child. Two of our pediatric and infectious disease experts, Dr. Crystal Whitcop and Dr. Esteban del Pilar Morales, are going to be discussing how to keep your kids both physically and mentally healthy as they return to school or remote learning or some kind of hybrid. The details are on our website at baystatehealth.org/schoolready. I'll end, as I always do, by emphasizing the importance of the preventive measures we've always talked about: masking, social distancing, hand washing. We've been very successful in Western Mass. I think we should all be very proud that we've been able to keep a lid on this terrible virus at a time when others in other parts of the country are really struggling. So I hope we can keep up our resolve and keep up our discipline, because that's going to make it a lot easier for us to move into some of the really important things we need to do this fall, like reopening schools. So again, I'll thank you, Mr. Mayor, for your time, and pass it on to Dr. Roos.
Thank you. Dr. Roos, Chief Medical Officer of Mercy Hospital Trinity Healthcare. Dr. Robert Roos.
Good morning, everyone, and thank you, Mayor. And I also want to offer my congratulations to your entire team for going green. For also, I think there was a day last week when you had 0 new confirmed infections last Tuesday. So thank you for continuing on that journey to zero COVID with us all, and for your efforts in leading that effort. I will say that one of the defining features of your work and the work throughout the Commonwealth has been the steady focus on following the science, right? Listening to medical experts, and by not always doing what's easy, but doing what's right by the entire community. So thank you. The numbers at Mercy Medical Center this morning and over the course of the past week have been very stable and are low. That's evidence, of course, that our efforts are having a positive impact. This morning we have 3 hospitalized patients, none of which are in our intensive care unit. And our test positivity rate has mirrored the state average as well. This past week, we were slightly higher. Just as Dr. Kerouac mentioned, we were at 1.2% over the past week, having performed about 2,500 tests this week and more than 36,000 now total throughout the pandemic. I want to state, however, that neither of those facts or the positive trends experienced throughout the Commonwealth means that we are past our challenges. It does not mean that we should be changing our course. In fact, as we've stated each week, this is really the time to bolster these efforts, not backpedal. More than 6 million people have been confirmed with a coronavirus infection in the United States, and as the projections would relate, more than 250,000 could die from the coronavirus this year. That would place it as the third leading cause of death in the United States after heart disease and cancer. And many of us, including myself, have had family members or close friends succumb to serious illness and die. For those of you that have not, who have not become sick themselves, or who have not had family or friends who have become sick or died from this disease, I would please consider yourself blessed. But do not for a moment think that you or your family are invulnerable. It's just not the case. As a healthcare provider who works with hundreds of other healthcare providers, we've seen hundreds, if not thousands, of people now become sick from this virus, including many who never would have thought that they could have become sick, like young people. And we've seen families deal with the unimaginable and unexpected tragedy and loss. Now, we're starting to see slightly different trends, with more young people becoming infected as opposed to older people. The rate of new infections amongst kids, even those under 18, is rising faster than it did earlier and faster than amongst adults. We also don't fully know the true extent of what the lingering or long-term effects could be, even from a mild coronavirus infection, as there may be effects that the inflammatory system can wreak on cognition, on the heart, or on the lungs. Particularly, we've seen that in folks with more significant infections, but there's a lot still that we have yet to learn. So while we are doing very well here in Massachusetts and many, many states in the Northeast, and starting to see the trend move in the right direction across the country, the pandemic itself still remains a significant individual and community concern for all of us. We must continue to focus on what's working. We must push these positive trends even further, and that will be what helps us prepare for and then ensure the success of a long-term recovery. Unfortunately, this past week, there was one federal action that flied in the face of that, and where it seems that politics has impeded upon the focus on sound science. Last Monday, as you may have heard, the Centers for Disease Control changed the guidelines on their website to state that individuals with exposure to COVID through close contact do not necessarily need testing. That was something that was done without any external communication, without any explanation, and to my knowledge, without any update to the science that underscores the importance of this type of testing amidst our public health response to this pandemic. To me, and to be very frank, at this point, that recommendation is counterproductive and doesn't make any sense in a situation where we are looking to expand testing and ensure that we can appropriately isolate and identify individuals with the coronavirus. Numerous studies have shown that there is a significant percentage of infected persons that may take some time to show symptoms or have minimal or no symptoms throughout their entire illness. It's also shown that many people who are asymptomatic or pre-symptomatic can effectively serve as a vector and transmit this virus. And it's true that we are only properly able to identify and then isolate individuals if, in fact, we know that they are tested and are positive. This testing of asymptomatic individuals with close contact is at the core, it's the heart of contact tracing. And the isolation of the individuals is one of the most important activities that we can do to reinforce and reduce and ultimately eliminate community transmission of the virus. So it's clear that if we ever want to eliminate this virus, we must not roll back, but we must expand testing. We've talked about this week after week, If we had nearly universal adherence to the guidelines of masking and physical distancing, widespread, accurate, and timely testing where we could quarantine individuals through contact tracing, and a data-informed approach to guiding our ability to engage in other activities like work and school and larger gatherings, we will move forward on our journey to zero COVID. But if we regress in any of those, or we were to stop testing now, we would begin to roll back. It only takes one asymptomatic individual with an infection at a gathering with others to create potentially dozens or even more infections. So a whole host of scientific experts from across the country have recognized this. And I will state that the Massachusetts Department of Public Health has not updated their guidelines and continues to remain focused on stopping the spread of this illness. So if you receive a call from someone informing you that you may have been in contact with someone who tested positive, I urge you to return that call. If you are interested in getting tested, you can contact your provider, or you can search online Massachusetts Stop the Spread and find free testing sites available to you. I want to thank AMR, who's hosting drive-through testing today at the Eastfield Mall, and thank Tapestry, who's been providing this testing at various points over the past several weeks here in Springfield and other communities. At Mercy Medical Center, we remain committed to doing what's right for you, and our providers will also gladly arrange testing for you as needed if you're concerned that you may have been in contact with somebody who tested positive. We continue to use testing methods that are the most accurate, using a molecular PCR testing with a nasopharyngeal or oropharyngeal swab. We are still evaluating the evidence for saliva testing, both saliva testing that looks for an antigen and saliva testing that would look for genetic material. We recognize that this is a type of testing that could offer benefits, but right now we want to ensure first that the test characteristics are of the highest caliber and that the supplies and the platforms would be available in order to do this type of testing before we decide on moving forward with that or not. As we prepare for the fall, we will continue to uphold and maintain safe and accessible care for all. We have gone to great lengths to acquire resources, including personal protective equipment. If you come to our facilities and you need a mask, we would gladly give one to you. We've maintained our surge plans and have plenty of capacity, and we've expanded our ability for you to see a provider, even in the same day, in many areas if needed. If you do come to the front entrance of Mercy Medical Center, you will notice that there will be some changes also over the course of the next month or so, as we improve some of the appearance and also some of the signage to help support your experience there. I do want to note that unrelated to COVID, a few weeks back, we had a delivery truck come into the patient drop-off area at Mercy, and it was an 11-foot truck, and there was a 9.5-foot portico. So it caused some minor damage to the lower portion of that drop-off area, and it has caused us to reroute patients and visitors and our colleagues through a separate entrance for the time being. It is a temporary change. It's one that's not related to COVID, and we know that you've all been through many changes over the course of the past 6 or 7 months, and so want to just apologize for the inconvenience and thank you for your patience. As we get that fixed and that entrance is improved, we will be adding additional signage and wayfinding to make it easier, more clear, and ensure that you know that entrance is a COVID-free zone. Other than that, I hope that everyone has a safe and relaxing Labor Day weekend. We recognize the important work of all of our colleagues at this time who've been there for each other and for our community throughout the pandemic. I hope that you're able to spend some time with your friends and family. This year, the celebrations will look different without parades and big gatherings, but they are to be enjoyed all the same. So please do wear a mask, always sanitize your hands, keep your physical distance from others, be cautious about whom you interact with and where you go, and let science continue to be our guide. There may be times when recommendations or practices change, but we must ensure that they are always supported by the evidence. We have strategies that work. We must not now stray from them. Thank you.
Thank you, Dr. Roos. Now we'll have Dr. Kerouac and Dr. Roos up for any questions that the media might have so they can get back to their respective medical institutions. Any questions at all? Paul? No? 22 News?
Sort of both was mentioned and along with the Holy Cross outbreak, and then Maine, who's had they've had a very successful implementation of COVID, but there was just a wedding up there that there's 30 people trapped there, and it's now spread to 80 or so. What does that speak to as far as just how easily this is spread? How, it doesn't take much to have a relatively large outbreak.
Before I answer that, let me just add something that I forgot to mention, and that is that virtual event on keeping your kids safe is this Wednesday from 12 to 1, and it's online. Details on our website. But I think you speak to a very important part of the biology of this virus, which is its ability to cause what are called super spreading events. And that before a person is symptomatic, or even without, if they're even without symptoms at all, they may be shedding large amounts of the virus. And if everything lines up right, if you're in a setting where few people are wearing masks, where people are crowded together in poorly ventilated places, and particularly if they're talking loudly or singing or something, that will create large amounts of virus in the air that people around them breathe. And we've seen similar events related to weddings and parties in Western Mass. So, we're always kind of on thin ice with this virus. We may feel pretty good about the way we are today, but all it would take would be a couple of people forgetting about the rules and having that happen at a time when one person just happens to be in that phase where they're shedding a lot of virus.
Thank you, Dr. Russo?
Yeah.
I don't have anything to add.
Any other questions at all, Eric, 40, Paul?
Doctors, I was curious, has there been any noticeable change in terms of what mortality has been cases of the virus locally? I mean, are you seeing that people are surviving more often than
Oh, yeah.
before? I know you were doing better early on anyway compared to like Boston area, but I'm just curious if you have any comment on what you're observing there.
Yeah, the survival rate is much, much better than it used to be. Mortality rates are much, much lower. I think I quoted you that statistic among the college kids, 26,000 cases, 64 deaths. It's a number of things. Number one, the attack rates in younger people seems to be higher because they are ignoring the advice more often. Plus, we have a number of interventions now, dexamethasone, prone positioning, remdesivir, maybe convalescent plasma that reduce the mortality rate. I guess the other thing I would mention is let's not just focus on death, though, because even people who survive a severe infection may have lingering effects in terms of how they think, how they breathe, how their kidneys work that go on for months or years. So the fact that, it's not just a live or die situation, you could be debilitated or really impaired for a long time.
Dr. Russo, thank you.
I echo everything that Dr. Kerouac is saying. I think both questions speak to the point that is important, that all community members and everyone does not feel a sense of invulnerability. That's certainly that one person that becomes infected could become an event where there's super spreading. And even if we're not talking about deaths, we are talking about a significant illness in some, if not many, and effects that could last that we still are not fully described or understood.
And in a related question, some people have, and I know that some of the effects are not going to be known for perhaps years, but some people do have very obvious effects. Is the ability to treat more effectively helping mitigate some of the worst of the effects that survivors are experiencing?
No, I think it's a great question, but it's still far too early to address that. Some of the lingering effects from the coronavirus infections appear to be due to inflammatory response that's triggered within the body. and it can lead to concerns with the heart muscle. It can lead to concerns within the lungs. It can lead to concerns in cognition or even the brain. What there are not present right now are studies on medications of how physicians or providers would treat those conditions over the long term. And so I think that is something that is still very much not completely understood and of concern, and it won't be fully understood until we have more time to be able to understand and research.
Dr. Carrick, anything you want to add to that?
No, I mean, most people believe that these treatments will reduce the rate of complications or damage to organs. But no, as Dr. Roos says, nobody really knows for sure because the studies have not been done carefully.
Any other questions or comments?
And I apologize if I might have been treading on some of the ground that Dr. Russo mentioned. There was an article recently in the New York Times discussing about how, the sensitivity to some of these tests might be a bit too high relative to what we need as far as like mass testing is concerned. Do you have any thoughts about some of the lower sensitivity, like, much wider number of tests that are being performed, with less materials, less time, to get faster results? I don't know if you have any comments on.
Yeah, I think that there are a number of tests that are coming online now that are can be done either at home or fairly quickly within an hour, and for broad-based screening, like checking out everybody before they come to college, pretty good, maybe good enough. The worry might be, I would think, that if you got yourself tested and you were negative by one of these fast tests, would you then feel comfortable not wearing a mask and just going around like Superman? So I think we still need to realize that there are false negatives and false positives for all tests. The kinds of tests that we are likely to use in a hospital setting really need to be highly sensitive and specific. We're talking 95% plus. And I think the data is not yet solid on some of these fast tests, even though they might be useful in certain settings.
Agreed.
Any other questions or comments?
And just one final question. You said it a number of times, like masks. And is it reasonable to think that might, or maybe we should start getting data that might be one of the last things that actually goes in this whole process? I realize that we might be months out from any near that, but there's a difference between never gathering and being able to gather with a mask on. And I just don't know if you give any thoughts on that.
Yeah, I mean, to me, that's the deal, right? I mean, that's the whole deal. I mean, is it possible to go to school with kids who are, sixth graders wearing masks? That's a better deal than not having them go to school at all. So we accept, the masks lower risk considerably, not to zero, but considerably. And so it's going to be a long time, I think, before we feel comfortable getting rid of the mask. We really would want to know that there was a good, safe vaccine that was highly effective and broadly given to the population before we'd all kiss these things goodbye.
Absolutely.
Any other questions or comments? Okay, hearing none, Dr. Kerouac, Dr. Roos,
Thank you, Mayor.
so
Thank you.
much for your team's efforts
Thank
to
you
stay
both.
healthy and stay safe. We'll now, Commissioner of Health and Human Services, Helen Carlton-Harris, will give her update. After Helen, because Patrick Pickering is here from AMR Regional Director, and we have specific testing that's going on, I will bring Patrick up for a few words just to say some specifics. People might be curious how they might be able to partake in that. So without further ado, Commissioner Helen Carlton-Harris.
Thank you, Mayor. First of all, let me start by congratulating the staff at the Springfield Department of Health and Human Services for getting to green. The staff has worked diligently and have worked together, and so these are the individuals who are answering the hotline. These are the individuals who are following up with the businesses in the environmental health team. The nursing team is doing the contact tracing. The administrative staff answering the phone every day for our residents who are calling and asking questions. We could not have gotten to green without your support, as a staff that really is diligent and committed to your work. So thank you to my staff at the department, and thank you to all of the individuals in the city of Springfield, our residents who have really done the job and adhered to the recommendations we have made, and so I thank you. As I travel around this city and I see our residents complying, it is telling me that you take this virus very seriously and you care deeply about your family and your friends. So thank you once again. As we start to look at the data as it relates to COVID-19, the mayor has given you the data for the city of Springfield. We continue to move in a positive direction. The mayor has given you the data as far as the numbers are concerned. Last week, we had 35 positives through the week. The week prior we had 35. Last week we had 31. 2 weeks ago it was 53. So as you can see, our numbers are trending in a very good direction. So we want to again congratulate our residents for that. I want to talk a little bit about some statewide numbers that we're looking at. The total cases in the Commonwealth is 128,229. 20.7% of that is Hispanic. 9.1 is Black African. 2.1 is Asian, and non-Hispanic is 31.4, which is white. The challenge with the data that we get from the state is 30.9% is unknown. So we're looking at data that is not quite representative because we don't have all of the data. There are 12,361 individuals hospitalized. That have been hospitalized, 14.3% Hispanic, 11.8% Black African, 7.9% non-Hispanic other, and 3.2% Asian, and 13% unknown. It's those unknown factors that I think we have to consider when we look at data. While we gather data and we report data to you, there is a fact known that we are not capturing, in many cases, all of the data that we need in order to report accurately. That is why we only report the confirmed cases and not probable. We want to make sure that we are concrete in what we are telling you. Tapestry, our testing front, Tapestry will be at the East Forest Park Library on September 9th, and at Van Sickle Middle School on September 11th. Both are from 3 to 6. Tapestry tested 115 individuals at SciTech. They tested 68 individuals at Brookings. To date, Tapestry has tested 775 individuals in the city of Springfield. I want to remind us that although the testing is done in Springfield, you don't necessarily have to be a Springfield resident to come to Springfield to get tested. AMR is testing at Eastfield Mall. I know that we'll hear more about that in a few minutes, so I will not go into that further. Currently, we have tested over 1,000 individuals in the city of Springfield between Bay State Health, Tapestry, and the small testing that was done at the urgent care facility. There were not a lot done there, but there were certainly a few. Getting to green has been something that we have strived for, and I've had an opportunity to talk to many individuals across the city around COVID-19. They're very concerned about the stigma that is caused by COVID-19. I've talked to many individuals who've told me that when they go back into some settings, the stigma remains. And so I want to be clear that the reason we keep the information confidential is because we do not want to have individuals' names, and we do give addresses only to first responders. I've heard from many individuals who have asked for more data, but we will not be releasing more data just because of the reasons that I've outlined. Some of our residents are really, really very concerned about information getting out there, and they're experiencing stigma. Travel orders. Important to acknowledge that Colorado, Delaware, West Virginia, and Pennsylvania have been exempted from the travel orders mandating a 2-week quarantine period or negative test. Connecticut, Maine, New Hampshire, Vermont, New Jersey, New York are still on the exempt list. Rhode Island has not been returned. So if you're traveling to Rhode Island, you still need to quarantine or have a negative test. We have come and will continue to exercise the power that we have as residents in this city. And I want to thank you very much for all that has been done. We have had several events at Court Square. We had an event at DeBerry, and we're very pleased that people did follow the recommendations and had on face coverings. I visited colleges and universities this weekend just to walk around and see what I was experiencing, and I was very, very pleased to note that all of our colleges, the colleges that I visited, the universities are taking this very seriously. I did not see one student or staff member who did not have on a face covering. I'm hopeful that this trend will continue. We are continuing to work with our institutions of higher learning. They are in touch with us. We have worked out our plans as far as contact tracing is concerned, who will behave in what ways. We have worked out memorandums of understandings with most of the institutions. We're looking forward to working together. We have a meeting on September 3rd with Springfield Public Schools to talk about working together around the mandate for flu shots. So as a city, many individuals have come together to get us to green, and I am very appreciative of the work of everyone involved. Thank you.
Thank you, Helen. Thank you very much, Commissioner Carlton Harris. Regional Director Patrick Pickering is here from AMR. I'm going to bring him up for a couple of minutes just to, because they're doing specific testing in conjunction with the City of Springfield. He can give to the residents who are viewing, a listening audience, and to the TV and to the print specific information. This is asymptomatic, so we've been very aggressive. Helen and I continue to call on testing, and more testing. Patrick Pickering, the AMR Regional Director. Patrick.
Good morning. Thank you, Mayor Sarno. Commissioner Carlton Harris, congratulations to both of you for green. That's an awesome thing, and it's a great accomplishment that shows the teamwork that has gone across the city in being put into getting to green and showing so few people testing positive. On the AMR front, we are doing public testing in conjunction with Commissioner Carlton Harris and Mayor Sarno for the City of Springfield at the Eastfield Mall on Boston Road daily from 8 a.m. to 6 p.m. And it'll be every day from today going forward to September 12th, excluding Labor Day. And you can just drive up and get tested. We are recommending pre-registration, and you can do that by dialing 1-833-AMR-COVI.
Thank you, Patrick.
Mayor.
Very succinct, right to the point. Thank you, Patrick, very much. We'll now go to the public safety component of the COVID-19 coronavirus update, and we will start with the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi.
Good morning, everybody. Thank you, Mayor. I'd like to report from the fire department this week. We have one employee out with COVID-19. He is asymptomatic. The last time I talked to him, he had a positive test upon returning from vacation. He's doing fine now. He has about 7 days left in his quarantine and is doing well. We had no major fires this past week. We did have several motor vehicle accidents over the weekend that kept us busy. We've been working on investigating fires with the Arson and Bomb Squad in conjunction with Commissioner Claproot's team and the State Fire Marshal's Office. That's my whole report this week. Thank you very much.
Thank you, Mr. Galvin. We will now have the Police Commissioner of the City of Springfield, Cheryl Claproot.
Thank you, Mayor. Good morning, everyone. We have 0 out right now with COVID, so we're not affected by that. We did do the drag racing over the weekend again. 5 arrests were made, several citations issued. We will keep that up as long as they want to keep it up. The detail will be out again all next weekend. We did, as the mayor told you, have a very successful event Saturday at the South End Community Center where I had 20 officers, male and female, participate in a shootout with students from around the area. And I'd like to thank the organizers of that event. It was wonderful. The officers teamed up with 2 kids, and they got to talk before the shootout happened. They went outside and they talked about a career in law enforcement and some issues the kids may be facing, and it was a good exchange. I would hope that the relationship maintains and they still connect with each other. It was an excellent event. Other than that, it was a pretty decent weekend. Thank you, Mayor.
Thank you, Commissioner Claproot. Another hot topic in the city of Springfield and really across the nation has been with our schools, and Superintendent Dan Warwick and his team are working very diligently on it. He has some updates as we move forward to reopening. The Superintendent of Springfield Public Schools, Dan Warwick.
Thank you, Mayor. Morning, everyone. Just a few announcements. On the meals front, we've continued with our successful meals program. To date, since we closed down on March 13th, we've provided families with 2,537,634 meals. On this weekend alone, we did 77,110 meals. There has been some issues with USDA relative to continuing the waiver on the meal program. As you know, as kids go through the line, they have to have their ID checked. We had a waiver on that so families could pick up. We've been able to get a continuation for most parts of that waiver successfully, which I'm thrilled about. We're going to have to change the program slightly. So on September 15th, we're going to be doing 2 to 6. We asked our families on Monday and Thursday what the best time to pick up the meals would be, and they indicated 2 to 6, and we're going to go Monday and Thursday at 2 to 6. 17 locations, as in the past. We've changed the location slightly, and they'd be available on our website. But on Monday, they'd be able to pick up for Tuesday, Wednesday, Thursday, on Thursday for Friday and Monday. One thing they would not give us at this juncture, but we're still trying to get, is the waiver for the weekends, so we can continue the weekend meal. So we're still working on that. But this was good news because they were talking originally about congregate meals, which in this kind of an environment just didn't make any sense to us. So I'm thrilled about that news, and we'll keep working on it. Our staff engaged in professional development last week. It was a huge success. We did the professional development remotely for the next 2 weeks because the DESE had given us a waiver for 10 days for extra collaboration and planning for staff. Our staffs will be working together in all of our situations remotely, and then reaching out, most importantly, to our families. So they established that connection for this year. So all of our families can expect to be contacted by the school, by their teachers, going over our remote learning expectations, which are much more significant than were in place this past spring, because this is a more long-term situation. So we think that will be a productive conversation between the families, the student and the teacher, so that we can establish this remote learning opportunity in a very positive manner. Remote learning will start September 15th after those 10 days. We're continuing to look at laptop distribution. As you know, we distributed 17,000 laptops this spring. We're reaching out to families that don't have a laptop yet, and we're going to make them available, and we're going to provide distribution through the school. The mayor's been supportive with helping us get vans, so that for families who can't get to the school to pick up a laptop, we'll actually deliver them again, so everyone will have the equipment. We also have worked with Comcast Essentials on the connectivity issue and have that all set up for all of our families so that this remote opportunity will be rather robust like we want it to be. I just want to thank the mayor again for the help with the laptops for our Case 2 students. We had a laptop for every other student during this summer. He approved with some emergency funds, us getting laptops for all of our students, so that's going to help us tremendously. He also stepped up because we looked at our preschool, since we're opening remotely, and we're going to provide iPads for all of our preschool students. So again, this will be a robust effort with our staff reaching out, but having all the technology we need to implement this successfully. So we're off to a great start. And again, I thank the mayor and his team. Helen, Pat Sullivan have been incredibly supportive of all of our efforts. And I feel the school committee made a great voting to open remote learning while we have the industrial hygienists go through all of our buildings. That effort is ongoing, and we're going to have good information so that when we open up, we can do it in a safe and successful manner. Thank you.
Thank you, Dan. Thank you, Dan. Thank you, Superintendent Warwick. We'll now go to our update from the Department of Public Works, and DPW Director Chris Signoli is here. Chris?
Morning, Mayor. Thank you. With regard to DPW, we are at full strength at this point. And just to reiterate from what I've been saying for weeks, our volume for both trash, yard waste, and recycling has increased significantly. So during the week, those services may take longer to get to you, but we will get to you. We had an issue last week with bulk pickup that is going to carry through for a few weeks with regard to our vendor and the location where we have to bring it. Right now, appointments are out a number of weeks, so if you know you're going to have material, please call 311 to get on the list for that. Other than that, DPW is at full strength, and we are very, very close to finalizing 100% the Six Corners project, so went through it, and it looks absolutely beautiful. So hopefully in the next week or so we can have a good event out there, and all of our other construction projects are fully underway at this point. That is it. Thank you.
Thank you. Thanks, Chris. Thank you, Director Signoli. Matter of fact, that Six Corners roundabout came up in good discussion at Mayor Sullivan, Billy Sullivan's funeral mass, and some people mentioned it, said, boy, it's wonderful there. So thank you, Chris, to you and your team, and MassDOT. I know when it was put across, people think of the East Long Meadow Rotary. It's no such thing. That's the character of East Long Meadow. No disrespect there. But this roundabout has been tremendous. So thank you very much on that. So I always say Springfield's in the business of doing business, and Chief Development Officer Tim Sheen and his team have done a great job. We pumped out millions and millions of dollars through Prime the Pump to help our businesses and nonprofits continue not only to survive but stabilize, and we're hoping to get to the next level at that. So without further ado, the Chief Development Officer of the City of Springfield, Tim Sheehan.
To quickly follow up on the mayor's previous comments with regards to Prime the Pump, we're very happy that 72% of the awards went to minority, women-owned, or veteran-owned businesses. That's important, not necessarily because of the statistic, but because the impact of COVID has disproportionately impacted Black, brown, and women-owned businesses, and we're very pleased that we've been able to get the majority of our funding out to those businesses. We are also working on an RFP that'll be coming out this week with regards to homeless services. That's part of the ESG funding that was part of the CARES Act. It will include outreach and rapid rehousing of the homeless population, and we're looking forward to that. As the mayor also indicated, we are finishing up our discussions with regards to contracting with Common Capital, but they are actively outreaching to businesses this week that are in need of capital. And if the businesses have contacted us, they should understand that Common Capital will be reaching out to them this week. Thank you.
Thank you. Thank you, Director Sheehan. Thanks, Tim, very much. As you know, Patrick, Director of Facilities and Parks, Director Pat Sull was unable to be with us today. We gave the update on that. The update from my Labor and HR Director, Bill Mahoney, besides unemployment, again, the travel restriction, which Helen Carlton-Harris touched upon. City Solicitor Ed Pakula updated us this morning, again, as I indicated, pertaining to MGM and our continued collaboration and discussion with Judge Ireland as we continue to work with Commissioner Clapper, all involved in working with DOJ to implement initiatives and some of Commissioner Clapper's initiatives on that. With that, I will open it up to questions of my cabinet heads and/or myself. Paul?
I've got a question for Helen.
Sure. Commissioner Carlton-Harris, please.
Commissioner, I know you said you visited some of the college campuses over the weekend. As you know, some of the issues that have come up, it was mentioned earlier today, the off-campus party at low cost. Some of these issues have involved off-campus activities. Have you talked to colleges about what their plans are for policing those activities? What role, if any, will the city have in that?
So a couple of things. One is, yes, we have had conversations with all of the institutions about not just party, but off-campus activities as it relates to their particular school. So yes, and will we be working with them? Absolutely. They are very serious about keeping down those kinds of parties. They will use their own security staff. They will work with Springfield Police Department as well as our code enforcement and our environmental health teams. So yes, we are working in partnership because we recognize that those events could be super spreaders, and we're concerned about those students on campus, but we're also concerned, obviously, about our residents. Should there be a cluster on a college campus, those cases will come through our Board of Health because the colleges will be using the Springfield address rather than the home address of the students. And so, yes, we absolutely have a partnership with respect to our work together.
Paul, just to add on to that, we, with the President, Dr. Robert Johnson of Western New England University, which Helen was part of that meeting for me too, we discussed that specifically on the off-campus housing and how seriously they're taking it. We've made major strides from years ago, and they're taking it very seriously, in which they will be either suspending students for a significant amount of time, although they will expel students. You know, this is not only for their own good and health, they're also out of respect to our neighborhood residents. The reporting, they're also going to be moving to contact not only the students and the parents, which they've done, but many a times these are, I don't say absentee land, but landlords that don't live at these establishments, and contacts working through my Echo Dev and building department. They'll be contacting them with informational flyer. And we're working with Commissioner Clapper and Deputy Kent with their chief of security there and they know each other very, very well to try to nip these things in the bud on it. And again, they have stated that if someone does get out of line, he or she will face a subsequent suspension, if not being expelled from the school. So it's for everybody's good health. Any other questions or comments? Okay. Hearing none, I really deeply appreciate the media being here every Monday to get the information out to our residents and business community, not only of Springfield, but I hear from many from all of Western Mass who view and watch this report. And I want to thank again from my cabinet heads down to rank and file, tested and true, been absolutely fantastic, and to the residents and business community of resiliency. I mean, it's quite a testament that we have gone for an urban center, not only in Massachusetts, but in the country, to go to green. We want to continue to stay in green and then move to white on it. But in order to do that, again, we're testing. We're doing much on asymptomatic testing, which Commissioner Carlton Harris and I have pushed for. We thank Governor Baker for Stop the Spread. But we need to be vigilant. As everybody's been saying, you got to wear those masks. You need the social or physical distance. If you don't feel well, please stay at home. And again, constantly wash your hands, clean your hands. It is making a difference. We had our trend seems to be this past weekend again, that we received reports, confirmed cases, new cases in single digits. You know, when we did have one last week, Helen, I believe, was 0. So we want to get it to a consistent point where it's 0, 0, 0. So again, I thank everybody, and go out and enjoy this beautiful, idyllic New England morning here in the city of Springfield. I love this weather. Just hot enough still to be summer, but cool enough in the morning when you wake up with that little tinge of fall. Great coffee weather. Stay well, and God bless. Thank you.